Hey, what's up, everybody? Welcome to Wellness Week Live again. So I'm your host, DJ Anthony. Today's special guest, she was so great the first time she came on about a month or so ago, our resident dietitian, Phyllis. Phyllis, thank you for joining us today on Wellness Week.
Thank you for having me again.
Yeah, you were so awesome last time.
Thank
and, again, I'm not kissing up to you, but I always say this to everybody. Like, you got a doctor, that's awesome. You got a trainer, maybe. Great. You really need to incorporate a dietitian or nutritionist into your life. You guys are the unsung heroes, and it's a shame that more doctors don't prescribe. Hey, call this dietitian, or this nutritionist, or this trainer. It's just, here's your pill, and pills are great. Listen to your doctor. But I always say, why not incorporate a dietitian into one's life? It's part of the holistic, total approach. But again, it's just. Am I wrong in saying this? Do you encounter this? Like, it's like, what? I mean, how do you not put a dietitian in part of wellness? I think we're getting better as a society with this. Am I right? Or like, what do you see out there? I mean, are you getting more busy of late, or is it just, I don't know, like, how does it, do doctors prescribe a dietitian or no? Because I never heard this, but.
Yes, I work inpatient, but there are registered dietitians that work outpatient, and absolutely, the patient would need a referral
from a doctor,
from the physician, from their primary care. So their primary care could be diagnosing them with diabetes for the first time. So they can write a prescription to see a dietitian, and they have to go under their healthcare network and find out who's under their plan that their insurance will cover, and they could go see a dietitian outpatient.
I see. Yeah, and again, we love our doctors. I have a ton of friends that are doctors. God bless the doctors and the nurses and whatnot. But so have you ever seen this? Why wouldn't a doctor or whoever just say, look, you don't have diabetes, but why not just prescribe a dietitian so you don't get diabetes? It seems like everything is like acute damage repair, but no one ever wants to get ahead of anything. So it's just like, you just alluded to it, hey, buddy, you got type 2 diabetes, see a dietitian, which is great. But it's a darn shame.
Well,
don't just prescribe a dietitian 10 years prior to getting diabetes.
Because insurance companies usually only cover services if there's a diagnosis already established.
Right.
So right now, I know in the works, there is, I think, something in the works where preventive care is in the future, where we could get covered. Our insurance companies will cover care before a disease sets in.
And right, because it'll be cheaper, which is a good thing, right? I mean, why would you want to spend more money at the quote unquote end of life when you could an ounce of prevention with a pound of cure? So I'm glad you brought that to light, because that makes sense. Even if you're a greedy insurance company, if you're greedy, perfect, then give the person the dietitian help so you don't have to pay as much on the back end. Ounce of prevention with a pound of cure. Okay. So I know that people, this is another thing. I always say people have money for an iPhone, the latest iPhone. People have money for vacations. People have money to go out drinking with the boys, drinking with the girls. People have money for the 19th pair of sneakers. I would make the argument, why not spend the money on a dietitian? I mean, it can't be that expensive. I mean, a brand new iPhone is like $1,000 and change. Like, buddy, you can't afford to spend a couple visits with a dietitian. Like, they could, but it's prioritizing. It's just, I'd rather pop the pill and whatever. So that brings me to our next thing, and this is why I wanted to have you on. You had a post about bariatric surgery. So, which has to do with weight and health. So for those who don't know or might not be acclimated or know what it is, what is bariatric surgery, Phyllis?
Okay, so bariatric surgery is weight loss surgery. And what it is doing, it's altering your GI tract. So it's either your esophagus, your stomach, or your intestines are being altered, either permanently or semi-permanently. So right now in the field, there are 3 procedures. The gastric bypass, they take most of the stomach and cut it away, and they leave maybe an egg size portion of your stomach, and they attach that to the second part of the small intestines, right. And that's about 2 feet into the intestines, and that's the most invasive.
Man.
The second is the gastric sleeve, the most popular. They cut away most of the stomach and leave like a narrow tube of the stomach that it goes right into the intestines. So it's actually like your esophagus into the stomach, into the intestines.
Right.
And then the third common procedure is the banding, where there's actually a cylinder put on the stomach, and it could be adjustable for your comfort, which allows another portion of the stomach, which is like an egg size, to be used, and that's it.
That's called lap band, I think.
Yes.
Oh, you see that? Hey, Dr. Capola's here. Okay.
Laparoscopic.
Right.
Mm-hmm.
Okay. So they sound pretty extreme. Wow. And so who is a candidate? Because I'm thinking, okay, if you're like 900 pounds, duh, you're getting this thing. But I mean, I'm sure that the threshold is much lower than your 900 pounds. I mean, so who would be a candidate? Who should be interested possibly in this? Because it seems pretty extreme. This is not. This is not outpatient, is it?
No, it's usually a day in the hospital. It's overnight, and if no complications, no problems, they can go home the next day.
Right.
The candidates are usually a BMI of 40. You know, a healthy BMI is between like 18 and 25. So a BMI of 40 or a BMI of about 35 plus comorbidities. So when I say comorbidities, someone that has either diabetes, heart disease, high blood pressure, sleep apnea, where they're at risk of, harming themselves by having this weight at this level.
Now, when you say BMI, I mean, I know what BMI is, but like a lot of, even when you say 40 BMI, what does that generally ballpark mean, like, so far as weight goes? Like, because I think a lot of people might be like, I don't know, BMI. Like, because someone might think that they're maybe bigger than they really are, or maybe they don't think they're big enough. Like, so yeah, what does it look like when you say that? Like, is somebody 10 pounds overweight, 100 pounds overweight, generally speaking? I don't know. Is there
usually a BMI of 40 or about 100 pounds overweight?
Okay. BMI of 40 is the minimum that a doctor would talk to you. So you can't be 10 pounds overweight and want bariatric surgery.
No, you could have a BMI of 35. So that's maybe 50, 60 pounds overweight, but there's other problems as well. You have sleep apnea or diabetes.
Okay. So you have to, or it's ideal, I say that loosely, ideal that you have to have those comorbidities and the weight. So if you have no underlying factors, it's only the weight. And you're not 100 pounds overweight, you're 40 pounds overweight, then you're probably possibly not a good candidate for bariatric surgery.
Correct.
Okay. Yeah, because I know people who, when I was saying this off camera to you, I have a list of people that have gotten bariatric surgery that I know of, and it's been hit and miss. Some people it worked out for over after 5 years, and some people it didn't. And there are some people that I had thought to myself, and I have actually said it to them, like, you're only 40 pounds overweight, like going, operation's serious. I mean, minor operation is only minor for the doctor. The person on the chopping block, that's a major thing, whatever it may be. So my thing to, that person was like, you still have to address, and here's where you come in, your nutrition. Like, you can't buck that. That's going to be, so do you find that, or do people say, or insinuate, I'm getting this operation, hey, I can still eat my cake and cookies and beer and sit down all day and pasta bread. Like, do people think, like, or no, like, do they, I guess you tell them, like, hey, you're going to have to make some serious lifestyle changes?
Well, a prerequisite is they have to be approved for the surgery. So in order to be approved, they need to pass the psych eval, number one. Number two, they need to see me for a couple weeks to months prior to the procedure to make sure they are able to understand their new, not only say yes, but they need to understand their new meal planning lifestyle after the procedure.
Okay. Yeah. If you got to pick it up. I don't want to hold you back. I know you're popular, but no, go ahead. I don't want to hold you back, but you want to take it?
No, I'm okay. Thank you.
Okay. Yeah. See that? I care about my guests. Okay.
Thank you.
So, so I thought, okay, so that's pretty involved. I didn't realize it was that involved. I thought it was just like, hey, look, I'm 100 pounds overweight. I have diabetes. Let's get this operation on. No, you have to go through a whole I didn't even realize. Okay, so there's a psychological aspect to this too.
Yes, you have to be ready. Yeah, you have to be ready for a lifestyle change. And the new meal plan is going to be pretty strict. So you have to learn about it prior to the procedure and really know, what you're going to be doing after the procedure.
Okay. And then I guess age, right? You can't be too young and you can't be too old. Like you can't be 100 years old and wanting this operation, right?
Correct.
And you can't be 13 and wanting this operation. I don't know. With daddy's permission.
They want you to be an adult, although there are cases where there's teenagers that are at risk for, comorbidities, and they do qualify. So every case is individual. It's an individual case that's going to be looked at by the physician and approved by insurance.
Right. And so when you talked about the 3 types of surgeries, this is which is the question, but can all of them be reversed, or can only one of them be? Is it the band that can be like quote unquote reversed?
The band could be adjusted and it could be absolutely taken off. That's the least invasive. The most invasive could be reversed, but it's a major surgery. Yeah. So, you are stapling organs, so it's probably not going to be 100% back to original. Right.
And of the 3, I guess, why would somebody pick one over the other? I guess you would have to, like, if I guess my guess is what, if you're more in a serious state of a condition, you would take the more serious route versus just it seems like that band is like the least serious, right?
Correct. Yes, the gastric bypass, the surgical removal of almost the whole stomach and the first portion of the intestines, it's really for people that are very overweight, morbidly obese, and tried everything and nothing has worked.
Right.
So that's the extreme.
Right. And so when, at least with me too, like when I hear, somebody's overweight, or I think a lot of people, and again, I'm no expert, but when someone says, they're obese or they're overweight, I have a feeling that when people, even myself, if I say overweight, I actually might be talking about obese. So like, what is the threshold of, and again, I know it's percentages and BMI and, whatever, but like if somebody is, I'm 5'11", I'm 170 pounds. I am not overweight. I'm not obese. But if I was 5'11" and 220 pounds, like, what's the weight, what constitutes obese versus, well, I'm just overweight?
It's whatever category your BMI falls in. So like, if your BMI is 18 to 25, it's a healthy category. 25 to 30 is an overweight category. 30 to 35 is obese, and over 35 is morbidly obese.
But does that take into consideration, like, if somebody's a professional athlete, they're a running back for the for the NFL, they're 5'11", 230, but they got 11% body fat, they're solid rock. I mean, so does that BMI or the your protocol take that into consideration?
Yes, they're gonna be probably looking for tests that are more like the percentage of body fat. We use BMI in a clinical setting, right. So we have to use the BMI for figuring out calorie and protein needs. This is what I do. Okay. So no matter what your body's made up of, I need that BMI to figure out protein and calories.
Okay.
So unfortunately, yes, if you're solid with muscle, you may 9 out of 10 times you're going to fall in an overweight category.
Which is really not accurate.
Well, it's accurate only in a clinical setting.
Right. Because I said, if you're the running back for the whatever New York Giants, you're not going to have you're going to have whatever 12% body fat. That's a solid, But okay, so BMI is what you have to do that protocol under. What is the umbrella?
Yeah.
Okay, and I'm sure there's some pros and cons to that. But all right, so once somebody has bariatric surgery, can they continue to eat cupcakes and doodles and soda and more beer because beer is cool? No.
No, it's a strict meal plan post-op. So
now is it strict forever, or is it just strict for like, hey, 2 weeks I can go back to cheese doodles and sitting all day?
Believe it or not, everyone is individual. There's some cases people can tolerate a lot more types of food, and there's other cases that there's maybe 3 items that can be tolerated. So it's an individual, it's like a, process of elimination. You start with clear liquids post-op, maybe for a day or 2. If your clear liquids, which are sugar-free and non-carbonated, if they're tolerated, you can move on to the full liquids, which is more like protein shakes.
Right.
If that's tolerated, it's a soft diet. But it's always going to be a high protein soft diet. Low fiber, probably limited with the alcohol, if any.
So low fiber for the rest of your life, essentially, correct?
Usually. The problem is...
But isn't that a problem? We're told to eat fiber. Now, I can't have fiber.
Yeah, now this is contradictory because it's such an extreme measure to lose weight that you are going to have to take lots of vitamins and supplements as well, because the surface of your stomach is so minimal at this point. And being like maybe the size of an egg, you got to remember, anything you eat, you don't want foods that will expand because the surface is so tiny. So fiber expands, even white starch expands. You have to probably avoid most of it and eat a high protein diet post-op.
So that's interesting, because then I would wonder, and I'm sure there's studies out there, okay, I can't have fiber. So I wonder, does that increase the chance of colorectal cancer? Because now the thing that would prevent you from getting colorectal cancer, you can't have. That's interesting. So, wow, that's yeah, it seems to me like you should only consider bariatric surgery if it's, you're on death's doorstep.
If you've exhausted all other options and the weight will not come off, and there's comorbidities that are existing because of the weight, you have to take, it's a balancing act. Which way is the healthier way? Which is the less of all evils? Right.
Know thyself. And if you know, hey, I'm not gonna do the things I need to do, right, and it's lesser of 2 evils, then you have to make that difficult decision. But it seems to me, again, just my tertiary observation of things and people around me, I don't know, it just seems like we're so quick to get the operation or get a pill. And this is the other thing I wanted to bring up. I was saying to myself, kind of off the subject of bariatric surgery, but even weight loss pills or whatever. I mean, I'm saying to myself, why don't people take care of themselves better or more often? And here's my theory. I think people think, and people in my circle think, that are not in good health, or, well, I am taking care of myself. Pills are healthcare. I'm doing the right thing. And my retort to that is, that's not healthcare. But I think people think that is. Like, even people in my close circle, they think, no, I'm doing the right thing. I'm taking care of my healthcare. I'm popping pills, and I'm getting operations or whatever. That's healthcare. And my response to that would be, that's not healthcare. That's damage repair care. Healthcare is seeing the trainer, seeing the dietitian, not the pills, not the operation. Again, listen to your doctor. If you need those things, take pills and operations. But that, I don't know, it seems like it's repair care to me, not really health care to me. And this is, again, why I speak very highly of the dietitian, dietitians and nutritionists and trainers. I think that's health care. Food is medicine. What we, this, I'm preaching to the choir, but what do you think of that theory? That people, do you see that? People think, well, I'm taking care of myself, but then you find out you're really not. You're drinking, you're smoking, you're eating crap food, and pills. It's only a small part of healthcare. I mean, what do you think about that? My theory.
Yes, no, absolutely. I truly believe you have to want to be healthy, though. It's a lifestyle. You can't take a shortcut and think you're going to be healthy. Right. So, there are cases out there, though, that it could be genetics play a big part of it. Right. Inheriting, a gene, obesity is a disease. It's, it could be inherited.
Can they take a test to see if you have a genetic predisposition for obesity, or people just throw that around loosely? Yeah, because everyone says that in my circles too. My friend, he went through quintuple bypass and all this stuff and blah, 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 blah. And he throws it around flippantly like, it's genetics. I'm like, okay, dude, have you seen what you ate? Have you seen what you're eating lately? Like, I don't know if it's genetic. Like, you're drinking, you're smoking, the cheese doodles, the cake, the cook. I'm like, I think it's, so my point is there like a test to, or do you even offer that to people to say, yeah, it is genetic, or no, we just assume it's genetic? If it's, I don't know, like.
I'm not sure if there's centers, that could run a test. We do not, but what I can say is if it's in your family, if obesity is in your family, or a parent has diabetes or heart disease, it just means that you have to take the extra step,
right,
and take care of yourself, meaning diet and exercise.
Right.
Yeah. And you have to, it's a way of life. Taking care of yourself is a way of life.
Because I hear so many people throw that around so loosely. It's genetic. I'm like, dude, have you seen what you're eating lately? Like, don't hide behind the genetic thing. You're not healthy. Like, no way. I think most of it is not genetic. I think my theory, what I see, because I see people say genetic, but again, they're on the cake and the cookies and the pasta and the bread and the pasta and the bread, and they're sitting all day long, and the soda and the beer. I think, my opinion, 9 out of 10 times, it's not genetic. It's lifestyle. And again, and that's a good news though, because we can control that. We can implement epigenetics where we can shut things off and turn things on. We are empowered to do so. I think it's a fait accompli to say genetics, throw our arms. No, I think we control this ship, and this is again where the dietitian comes in, get yourself a dietitian or a nutritionist and a trainer, because that'll keep you out of surgery. And if you need surgery, you need it. But I think there's a lot that we can do. By the way, I said before, I'm 5'11", 170. I used to be 30 pounds overweight. I was 200. And I didn't lose it overnight, but I was like, what am I eating? Took a hard look at what my lifestyle was. And it was a lot of cookies, a lot of soda, a lot of cake, a lot of Nutella, a lot of bread. I mean, I was living on this stuff, and I thought I was healthy. I mean, but anyways, so, okay, moving on. The next thing I want to ask you is, so now to that point, actually, so I don't want it to paint this picture that, it sounds like, oh man, it really sounds horrible trying to be healthy. My response to that is no. When you change your lifestyle, when you eat quality food, you don't put crap gas in a Ferrari. Our bodies are Ferraris. You put the highest octane. So when you're eating right, when you're eating healthy, you're going to be happier. Don't you want to be happier, everybody? So it's not, I think sometimes people think, oh, if I change my diet, I don't even like to say the D word, but if I change my whatever I'm eating, I'm going to be unhappy. And, and that's the furthest thing from the truth. I tell people, you want to be happy? Eat better, exercise, get out there. So, but you have to have some naughty foods once in a while. My favorite thing is Lucky Charms cereal. Yeah, it's junk, but I treat myself. So what would be a junk food or naughty food that Phyllis, the dietitian, once in a while enjoys?
I love fried food. So if I'm going to indulge, it's going to probably be something fried.
Okay. So, yeah, I mean, and I think people need to hear that too, because I think, especially a dietitian, they're probably going to think like, oh, all she does is live on celery, please, Right. And I like to tell people that too. I eat junk food once a week, once a week. But yeah, I think it gets a bad rap being healthy. People think, oh, you're living on carrots. And that's like the furthest thing from the truth. But okay, so that's your naughty food, fried. Yeah, no, I mean, I love my fried foods too. So what is, you mentioned proteins before. When you say proteins as it pertains to bariatric surgery, are we talking chicken here, or are you talking like protein? Can I eat chia seeds high in protein, or no, if I had bariatric surgery?
Correct. Well, seeds and nuts are really part of the fiber category.
Oh, okay,
so
that's right. You can't have that.
You got to remember, so the size of an egg maybe is your new stomach area. So you want to have nutrient dense but high protein foods. So, and soft food. So like the eggs are usually great. Egg whites are perfect. Protein shakes. And also I've found that ground meat, like ground turkey or ground beef, because it's already like crumbly and a little bit more easy to chew and digest versus a chunk of meat.
So then you guys would be a big proponent of, I guess, nutritional shakes, right?
Absolutely. Protein shakes are great. Absolutely. After post-op, the protein shake, the eggs, cheeses, yogurts, low-fat dairy is great, that whole area, if it can be tolerated, if someone's not lactose intolerant, they could have a lactose-free dairy product.
Right. So what about,
that's good.
okay, because what you're describing is kind of like the lifestyle I'm on now. I cut out 98% of my breads and pasta. I mean, I come from an immigrant Italian family. I mean, forget it. Bread, pasta, bread, pasta, bread, pasta, bread, pasta all the time. Bread, pasta, bread. And well, anyways, long story short, I cut that out. Now, the reason why I'm saying that is, I don't know if it's you or whoever, the doctor, what happens to cholesterol levels then? Because I'd make the argument their LDL and their cholesterol might actually drop because they're not consuming refined carbohydrates. And maybe counterintuitive, because people might say, oh, I'm having a lot of proteins. Maybe that would raise my cholesterol. I mean, what do you see? I mean, is it raise the cholesterol, lower it? Because
no, what happens is when you lose weight, everything goes down. So your blood pressure goes down, your blood sugar, your blood cholesterol, everything drops. So this is why this procedure is very invasive, but it saves some people from comorbidities because it's lowering everything.
Okay, because I stopped eating my breads and pastas and chips and cake and cookies like 6 days out of the week, and my cholesterol, my LDL dropped. So
because you were probably consuming hydrogenated, the trans fats.
Yeah,
that's in packaged goods, and that raises the bad cholesterol in your body.
Right. Yeah. So I thought that was interesting. I was like, oh, that's odd. Like, how did that happen? And I was doing a little research to your point, and they were just saying that there is some correlation also between, consuming massive amounts of bread and pasta. That actually doesn't, because it's, refined sugar. So that's also not good. So I was like, huh. So tying that into bariatric surgery, consuming proteins. Okay. And as we're coming down on time here, so what would be, just generally speaking, aside from the surgeries, this is kind of a simple question, but I think a lot of us, even myself, I think I thought I knew and I didn't. So what are some good foods and bad foods? So someone wants to take care of themselves. Like, I thought I was doing the right thing by consuming bread, pasta, bread, pasta, bread, pasta. I was consuming way too much of it, and it's refined carbohydrates. And I didn't know we need carbohydrates, but we need the right type vegetable. So what would be some idea, like quickly, what would be a good food and a bad food to eat? So yeah, I don't know. What would
nothing to do with the bariatric surgery?
Nothing to do with bariatric. I want to stay out of the operating room. So what? Yeah. So like I'm just somebody that knows nothing, and I'm like, okay, Phyllis, the dietitian, what's a good food that I could eat to?
Well, what I would say overall, the healthiest diet, meal plan, lifestyle is the Mediterranean diet.
And that is?
The foundation, it's opposite of what you are able to do after bariatric surgery, but the foundation is whole grains. Every starch you take in, whole grains, seeds, nuts, lots of fish, lots of fruits and vegetables, lean meats. Your oil.
What is a lean meat?
Your lean meat is the lower in saturated fat and cholesterol. So when you're actually looking at your meats, it's a lighter shade. Usually the darker the meat, the higher fat and the higher cholesterol. So you're talking about your fishes, the white chicken, the white turkey.
Okay. Now, this is a big one. And I succumbed to this earlier on in my life, where I was like, oh, sugar-free. Yeah, sugar-free, 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 sugar-free. Kind of a rhetorical question, but okay, is sugar-free good for me? Because it says sugar-free, it must be good.
Well, inpatient-wise in the hospital, we have such a large percent of diabetics. That's from real sugar. We do not have any patients admitted for Splenda toxicity. So that's your answer, right?
Okay. So yeah, because my understanding though is that when they take the sugar out of whatever, they have to add other stuff in to make it taste yummy, yummy. And so, okay, I guess my other question would be, when something's no sugar, do you often see people gain weight though, or no?
Well, at the end of the day, it's just taking in more calories than you're burning off, no matter where they're coming from. But I mean, there's a lot of different, it's either you're gonna eat a meal plan that's healthy, or you're gonna eat a meal plan just because it's low in calorie. That's not good either. That's not the healthiest choice.
Right, which is my next question. What about empty calorie, full calorie? So if I say to you, well, Phyllis, I mean, look, 100 calories is 100 calories. So what? I ate a 100-calorie cupcake. I could have eaten the 100-calorie broccoli, but they're the same thing, right, Phyllis? 100-calorie broccoli and 100-calorie cupcake, same thing? Yes or no?
No, and that's what exactly, like you're taking in calories with no nutrients, no nutrition value. You're just taking in calories versus taking in 100 calories of packed vitamins and minerals and fiber and things that will keep your immune system strong and keep your body healthy.
Okay, and you just mentioned the key word immune system, and now that's the rage nowadays. Everyone, immune system. So, what would be some things I could eat or to boost my immune system? So, would cookies and beer and soda boost my immune system?
No. So of course, antioxidants, which neutralize free radicals, which your body produces every day, free radicals. So an antioxidant will neutralize that. So you get your antioxidants from your produce, pretty much. That's what they say, 5 a day. Absolutely.
So your broccoli, cauliflower, your salad, your beans, your vegetables is where you're going to get the immune boosting
antioxidants
benefits.
And also your protein will help keep the immune system strong as well. But you don't want to take in too much fat and cholesterol. So you want to have lean protein. Protein shakes are fine. Low fat dairy is great. Fish, chicken, turkey.
Right.
All good choices.
And fruits, I guess, right? Is part of that. Your strawberries, blueberries, whatever.
Your fruits and vegetables are your produce. So that's going to give you abundance of antioxidants to neutralize your free radicals and keep your immune system strong.
Okay. Yeah, because that's one of the things that kind of rubs me the wrong way nowadays. Everyone's like, and again, listen to your doctors, get your shots, wear your mask. That's awesome. Do it. Anything else, everybody? No, that's it. Like, okay, what about what I eat, though? That protects my immune system. No one mentions that. It's like, again, back to dietitians I think you guys are the unsung heroes of the immune world, but and it's just quick to pop a pill, wear a mask, take a shot, which we should do. But again, what about eating vegetables? That boosts our immune system. No one talks about that. But all right. But so that's why I have you on, Phyllis. All right. So in closing, and I appreciate, because we're basically done on time. I want to respect your time. I asked you earlier off camera, one of my things that I like to ask all the guests nowadays is, what is one thing that you're grateful for? So for me, and I had mentioned this yesterday on the show, one of the things I'm grateful for is my dog, Rocky, the Shih Tzu. An asset in my life. I guess today too would be, I'm grateful for, my friends. I'm going out to lunch later or whatever. So what's one of the things that you're grateful for? Because, we live in a world where everything is bad. Everything stinks. So, gratitude is, I think, a great way to help boost our immune systems and our mood. So what's one of the things that you're grateful for in your life today? It could be a small thing.
Yeah. Today was that the sun came out. Any day that the sun comes out.
Vitamin D3, immune booster, the sun.
Yeah.
And is it true that the sun is the greatest form of vitamin D3?
Yes.
Okay, so we should get some sun.
Definitely should take a supplement in the winter.
I just started doing that, actually. Yes. Okay, D3, but the sun is the best form of D3.
Yes.
Okay.
The sun is healthy in what do they say?
Portions.
Small increments. Yes.
Right. Okay. Cool. Awesome. Well, Phyllis, again, thank you for making time. And if anybody has any questions or whatnot, you can contact our dietitian here, Phyllis, at our email there, or if any comments or questions below on the comment section of the Wellness Week. But I really appreciate you making the time, Phyllis, again. And
absolutely.
Yeah. Thanks everybody for watching.
Thank
you. Hit the subscribe, the notification, share with a friend, share with the family. Thank you, everybody. So have a good rest of the week, everyone. Thank you, Phyllis, again, for making time.
Thank you.
3, 2, 1. Bye-bye.